Smart Chiropractor Show, clinical conversations. Let's bring up that little spot there. There we go. Each and every week, we take a few moments to highlight some of our friends, our mentors, our peers, our colleagues, people who have really great inside information in the clinical realm. And today is no exception. We're going to highlight an Axis presentation by Dr. Kevin Christie that's all about back and shoulder management of golfers. It's going to be a little sneak preview. Axis is our annual event with the Smart Chiropractor that is exclusively focused on clinical aspects of practice. Keep your eyes peeled for Axis 2022 coming later this year, but we've enjoyed taking a peek back at Axis 2021 throughout our clinical conversations segments on the Smart Chiropractor Show. Today is no exception, and without further ado, let's head over and watch a few moments of Dr. Kevin Christie's presentation from Axis 2021.
Hi, I'm Dr. Kevin Christie, and today we're going to really dive into the trunk and shoulder relationship for golf injuries. But before we get to that particular video where I run through a lot of functional testing and certain things to look out for as a clinician working with golfers, I wanted to actually start by how to position yourself as the expert treating golf injuries. And there's a lot to it, but it doesn't have to be overly complicated. I'm certified in the Titleist Performance Institute, which you'll hear me talk about in the instructional video. You don't have to be certified in that. There's other things. There's other knowledge training out there to work with golfers. There's a lot of different ways you can treat these musculoskeletal conditions and injuries that you see in golfers. But I want to give you the best way to start to position yourself in that, because it's going to take clinical expertise, as we know, but it's also going to take getting out there to a certain level and positioning yourself in that. So I want to go right into a screen share, and we're going to go through a little audience builder and try to start really working on building that audience of golfers and getting a clear message for that. So let me share the screen here. In step one, you're going to see, this is a Seth Godin concept of the XY axis of positioning. And we're going to go right down into here where we really want to get into this upper right quadrant of expert in golf injuries. If you're new to treating golfers or you're a recent graduate, the reality of it is the eye of the beholder. You're probably in the non-expert. And if you haven't done enough to position yourself as a golf injury expert, you're probably in the general category. So we want to do things to start moving that dot to the upper right. Okay. A great example of someone that has transcended even the chiropractic profession and who is a chiropractor as it relates to golf is Dr. Greg Rose of the Titleist Performance Institute. And he is working with pro golfers from a technique standpoint. I mean, he's completely transcended the community and even the profession. You don't have to do that. You just have to get to the point where when someone thinks of the doctor to go to for a golf injury, it's you. And that's what we want to make sure we do by understanding golf injuries, which you'll see in the instructional video, but also how to get your message out to the right audience. Okay. So obviously, for the sake of this video, if you're trying to position yourself with golf injuries, we want to do everything we can to get that dot to the furthest upper right quadrant in this particular XY axis of positioning. And in my opinion, aside from really good clinical skill set, having a great content marketing strategy around that will help do that. Okay. So we're going to go down and we're going to skip step 2. That's determining the psychographics of great patients, and golfers tend to fall into that. So we're going to just go right into a golfer, and we're going to scroll all the way down to part 4 here, where is finding the congregation points that these groups can be found. Okay. And there's an offline congregation point and there's an online congregation point. And so if you're going to be working with golfers and getting them as patients, these are the places you can find them, right? Golf courses, country clubs, golf stores. I remember when I was, I've always wanted to really work with golfers. And when I was at chiropractic school in Logan, I actually worked at a Golf Galaxy there to try to learn as much as I can about the sport and things of that nature. I'm not telling you to go get a second job, but I can tell you there was a ton of golfers in that store. So connecting with the folks there, a lot of these big golf stores now have even teaching pros there. There's a lot of different aspects of that they have. So check that out. Okay. And then, teaching professionals, connecting with them, golf specific personal trainers are great. All people that can really refer to you and you can find golfers. Okay. Online congregation points, Facebook specific targeting. You can really do well with targeting golfers with your videos and blogs and things of that nature. There is a TPI, golf referral directory, where you can find fitness and golf professionals certified in TPI. Closed Facebook groups are great. Instagram and YouTube. A lot of people search for golf health and performance tips on YouTube. It's the second largest search engine there is. And you can get a lot of traction there if you're shooting consistent videos. Okay. Perfect. So that's where you're going to find these folks, and that's how you're going to build that audience. And then we're going to go all the way down, and we're going to start developing a really clearly defined message for them. All right. And you can see here, we broke this out. And if you're familiar with the Donald Miller building a story brand, he really talks about getting to the real problem of the consumer, right? In this case, the patient. And a lot of times we think of just the diagnosis, but it's really deeper than that, right? So Donald Miller talks about the external conflict, the internal conflict, and the philosophical conflict of the person, the character, or the hero. And so the way I like to do this, basically the external conflict is the condition they have, as this relates to chiropractic. The internal conflict is what it's preventing them from doing, that's really gnawing at them. And then the philosophical conflict really is like, okay, who are they've once the internal conflict has gotten, to the point where they're ready to do something about this. Now the next thing is who are they going to go see? They've got a lot of decisions to make. And so there's a philosophical conflicts is, why are they going to pick you over the orthopedic surgeon, the massage therapist, the physical therapist, the primary care doctor, the acupuncturist, right? Heck, even the personal trainer nowadays. So there's certain philosophical conflicts that they have, and we'll run through that. And when you're creating your content or communicating with the patient on their injuries, any of that stuff, you want to really address these three things, right? So I like to take the audience, which is in this particular case, the golfer, and pick the most common golf related injuries. And in this order, it is low back pain, shoulder pain injuries, wrist elbow injuries, and hip pain. All right. And so those are going to be our external conflicts. And I'll break down what this looks like in a little bit here. And then the internal conflicts more is like, they don't want to miss out on that member golf tournament, right? Like last week, I had a guy come in with a calf strain from playing basketball, who happened to also supposed to be leaving that later that week to go play at Wingfoot, which is a really high end country club that US Open was at recently. So that was his motivator to come in the office like every day for 3 days before he had to leave to try to get this calf fixed. And so that was his driver or his internal conflict, right? So some of these other ones don't want to miss out on the member golf tourney. Be able to play golf satisfies their competitive drive. Socializing with their friends is a big component of their life, and that's on the golf course. Not being able to play golf makes them feel old, right? So there's a lot of different internal conflicts that the golfer has. Then some of the philosophical conflicts would be is they don't want surgery, right? They don't want to be prescribed long periods of rest. What happens when they go to the orthopedist? They try to rule in surgery, obviously, or they give them 8 weeks of rest. They don't want pain medications, and they're afraid that having a disc herniation that will prevent them from playing golf for a very long period of time. And as a chiropractor, you can really solve those conflicts that they have, and they don't want those things. They want to find some kind of natural solution that's going to get them better, keep them better, and get them back to golf as quickly as possible. And that's the void you fill in the marketplace. And that's what you need to be talking about when you're conveying this message to golfers. Okay. So once you've broken down the problem that these golfers face, we're going to go down and skip down to here. And as you can see, you can apply this to all kinds of different types of patient population, which we did for this example. But now we're going to apply story, step 6, to your clearly defined audience. And the way that it's broken down by building a story brand by Donald Miller is, part 1 is you have a character hero. Okay. 2 is they have a problem, which we just dissected out. So your number one is your golfer, the character or the hero. Two is the problem. We just, like I said, broke that down. Three is we introduce the guide. So that's now where I introduce, okay, now I am the chiropractor that knows about golf injuries, and I'm going to guide you to, where you want to get to. Step four is we're going to develop a plan. Five is they're going to take action on that plan. And if they take action on a plan, if they're going to avoid failure, which is six, and it's going to lead to success, which is seven. And as he discusses in that book, that's how all story plots are designed in that type of format. And so we're not trying to play like, verbal gymnastics with anybody. We're just trying to make that about them and break it down into a way they can really comprehend it. Okay. And so if I was sitting down giving a report of findings with that golfer, or if I was shooting a video, I would really dissect out that problem. I'd be like, okay, Bob, your good news is there's no disc herniation or red flags, but you do have a low back injury. I think it's overuse strain from golf, and obviously you have this tournament coming up in a few weeks, and you want to get ready for that. So that's our goal, not only just to get you pain-free in activity daily living, but also to play golf at a high level and perform well. I don't think you need MRIs. You don't need to go to orthopedic right now. We can really handle this internally at our office and get you feeling better as quick as possible without having to take any type of pain medication or any issues with surgery or things of that nature. So that's where I think we can really help you out. Then you would get into, the plan, right? Give them the treatment plan, or what does that look like? And ask them to take action on that. If there's any round warm-ups you give them, or any exercise at home, they need to take action on that. They need to schedule out of their treatment plan. That's taking action, right? All those things we know, if that patient does, that is them committing and taking action. And if they do that, that will lead to success, which is obviously playing golf in a few weeks. Okay. And so no matter if you're writing a blog, shooting a video, public speaking, doing a workshop at a country club, doing a report of findings, you can really work through that story brand and really dissect out that problem. And that will help really connect with that golfer, whether it's the patient in the room with you or it's the prospective patient out in the community that you're educating through content marketing. Okay. And just to kind of wrap up this first segment of this video before we dive into the hands-on portion of this, is that the more you educate on golf injuries for this particular lesson, and really get that information out there and become a leading educator through your content marketing strategy, it's really going to help move that dot from the bottom left quadrant to the upper right that we showed in the XY axis of positioning. And it's going to really help you get a lot of golfers into your office, which will then even get you better at assessing and treating golf injuries. Okay. I hope that was helpful for understanding how to position yourself as a leading expert in golf injuries. Now, this video that we're going to transition to now is going to give you some take-home things you can apply to your practice then.
That was Dr. Kevin Christie for Axis 2021, and just a great example of getting out there and teaching, right? Before you take care of golfers from a technical capacity, you have to have a few golfers in your practice. So understanding how to attract more of your ideal patients, core tenet of what we talk about when teaching and inviting consistently within the Smart Chiropractor. And I think Kevin did a great job breaking down that tactical approach. Jason, what were your thoughts?
It's exactly it. We love featuring people that are, aligned with our philosophy. And it's a perfect example. When you talked about Greg Rose and TPI, he's one of the best shining examples of you can build a practice with any type of client that you want to. You and I met Greg and had a great time with him in Vegas 2-3 years ago now. Good dude. He told us his story, and everybody, and he said everybody told him when he said, I think I want to build a practice with only golfers. Everybody in his life said, no way, that's impossible. You're crazy. You're out of your mind. And as we talked about in previous segments about mindset, he is proof that if you'll teach people about what they need to know to perform the way they want to perform, whether that means to get out of pain or hit a putt, when you teach them that you can assist them, as he talked about in StoryBrand, create that bridge from where they are to where they want to go, that is the formula. We just simplify it by calling it teach and invite consistently, because that's what you do. But it does start with a vision. Well, what am I going to teach them? What kind of dream and practice do you want? Kevin did a phenomenal job. What a great guy. And I know he's up to some great work as well. So thanks for joining us, Kevin. That was great.
Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.